Symptoms of pregnancy. Might you be pregnant? The evidence is in the paternity test. But you might also presume or hope of your pregnancy until you fail one time. Know the first pregnancy symptoms and why. Some classical pregnancy symptoms. The first, early signs and symptoms of pregnancy can be period missing. You could be pregnant if you have been in your teenage years and a week or more without the starting of the predicted menstrual period. Although if you have an abnormal menstrual cycle, this symptom may be deceptive. The breasts are tender, bloated. The hormonal changes in your breasts can sensitize and make you feel sore early during pregnancy. The pain would generally fade after a couple of weeks when the body adapts to hormonal adjustments. Nausea, vomiting, or not. Any day, or evening, morning sickness also starts 1 month after you get pregnant. Some women, though, had nausea before, and some never experience nausea. Pregnancy hormones presumably play a part, but the cause of nausea during pregnancy is not exact. Enhanced urination. It could be more frequent than normal for you to urinate. During breastfeeding, your body's blood rises to allow your kidneys to handle excess fluid that ends in your bladder. Tiredness. Early signs of pregnancy are also high in fatigue. The hormone progesterone levels rise during early pregnancy, which could make you feel tired. Some less obvious signs and symptoms. Some less noticeable pregnancy signs and symptoms you can face during the first trimester include moodiness. In early pregnancy, the surge of hormones in your body will cause you unusually distressed and weepy. Also, mood swings are normal. Bloating. Similar to how you would feel at the start of a menstrual cycle, hormone changes during early pregnancy can trigger you to feel bloated. Light spotting. One of the earliest symptoms of pregnancy is often a slight amount of light spotting. Identified as implantation bleeding, it begins about 10 to 14 days after conception when the fertilized egg attaches to the lining of the uterus. Bleeding from implantation happens around the time of a menstrual cycle. Not all women have it. Cramping. Early in pregnancy, most women feel moderate uterine cramping. Constipation. Hormonal shifts cause a slowdown of the digestive tract, which may lead to constipation. Aversions to food. You can become more susceptible to certain smells when you're pregnant, and your sense of taste can change. These dietary habits can be chalked up to hormonal changes, like any other signs of pregnancy. Nasal stuffiness. Increasing hormone levels and blood flow can quickly induce swelling, drying, and bleeding of the mucous membranes in your nose. This could trigger you to have a nose that is stuffy or runny. So can you be sure about your pregnancy, though? Many of these signs and symptoms, sadly, are not specific to pregnancy. Some may mean that you are getting sick or that you are about to begin your period. Similarly, without noticing all of these signals, you might be pregnant. Still, take a home pregnancy test or visit a healthcare provider if you miss a time and note any of the following signs or symptoms. Create an appointment with your healthcare provider if your home pregnancy test is positive. The sooner your pregnancy is confirmed, the sooner prenatal care will begin.